Let me start with you, Dr. Gupta. So the president has tested positive, that we know. There are frequent rapid tests conducted at the White House. They are said to be less accurate. Is it your presumption this morning that the president likely also received that, what I consider the creme de la creme of tests? They call it the PCR test. It is more accurate. It takes longer to get results. Is it your assumption, doctor, that that's the test he had that revealed this diagnosis?
Good morning, Savannah. It's certainly my hope that that's the case, because if he didn't, then what I would want to know what was the test. What's been thrown around is this idea that the Abbott ID Now test is the test that all senior staff in the White House and the executive have been utilizing for these trips. That specific machine, we know, has a false negative rate of up to 50% in some cases per a recent NYU study. So the fact that Hope Hicks on Tuesday potentially tested negative and then was developing symptoms on Wednesday, that test was effectively meaningless because she could have been pre-symptomatic but positive. And we know that younger individuals, she's 31, that are infected could still be shedding the virus and are infectious to others. So that's the deep concern here. Do they just not have the right testing accoutrements, that right rapid test, to make sure that they have the confidence that the test result is actually accurate? And I'm concerned specifically on that.
All right, Dr. Gupta, let's assume for all intents and purposes that he does in fact have it. He's 74 years old, and we've done a ton of stories on how when you're older and have other underlying conditions, there are more problems with that. When you look at this particular case, what's your assessment of it?
I'm worried, Hoda. The president is 74. And he also has something we call metabolic syndrome. His weight's above a level that we would actually call him overweight, obese. That combination, I've cared for several patients with that double whammy of being a higher age and then also being overweight. They tend, if they get sick, if they become symptomatic, they escalate quickly, potentially to needing or requiring ICU level care. So you can imagine his physicians will be looking at his oxygen level using something called the pulse oximeter. They'll be seeing if he's short of breath. Does he have a fever? Does he have chills or a cough? Very extreme vigilance here is warranted for the president, for the first lady, for anybody. But they're going to be looking specifically at those early signs and symptoms that might suggest that he needs hospital-level care.
Really quick, Dr. Gupta, I mean, you're a doctor, not a politician, but when I look at what his physician said, he said that the first lady and the president are well. He did not say they are symptom-free. Did you read into that in any way?
I did. Savannah, I think it's important that they overshare information. I want to know what's his symptom profile. To your point, to the first lady, how's the first lady feeling, and critically, what is Hope Hicks feeling like? Because if she was a high risk exposure because she's very symptomatic at a young age, then that's concerning. That means everybody on Air Force One, everybody else potentially they came in contact with, needs to isolate for 14 days per CDC guidelines.